Welcome to Let's Talk About Health, an informational podcast that gives you insights on health and fitness from experts themselves that you can apply directly to your own personal health and fitness stories. Come join me today to hear all about what they have to say on health and fitness. Hello.
Hello, how are you?
Good. How are
I'm
you?
doing very well, thank you.
I hope it's okay. The camera is okay.
Yeah, seems fine.
Oh, look at the snow outside. It's a very pretty snow.
It's not snowing?
Yep.
I think it's just raining over by me.
Really?
Looks like rain. Yeah,
Oh,
that- that's
yeah. It's a
okay.
very pretty snow out here. So,
That's
yeah, but
nice.
I don't like it. I mean, I don't like to be outside in the snow, if you know what I mean.
Yeah, hopefully it's not sticking, so it's not so bad when you're driving.
Hmm.
Yeah.
Also, I'm from India, so I'm very like snow is a different concept there. So, how you been? How was your day? I see you're still working.
Yeah, it was a long day today. Started with some house calls and then at the office until about 4 o'clock, and then I just figured I would hang out
Yeah,
until our conversation. So yeah, typical day.
that's good. It's good to have a typical work day.
Yeah, yeah, very busy, but that's good. That's busy means that we're growing and we're doing well.
Definitely. Mm-hmm. Okay, so let's start. Today we have Kyle here with us. He is specialist in so many aspects that I myself have so many questions today that I want to ask you, and I hope I get my answers because there are so many things you specialize in, and it's such a new, fresh technique that you're coming up with. You're seeing results. You're uh, doing it with your patients. So I'm so interested to talk to you, and we've been trying to get our schedules, just our schedules matched up for us to have this conversation, but finally we're here, so I'm happy about that.
Yeah,
I
we finally made it work.
Yeah,
So
I'm very excited. Okay, let me start by asking you my favorite and my very first question. What, according to you, is health, and what do you mean by fitness?
I'm sorry, can you say that one more time?
What is the definition of health according to you? How would you define health and fitness?
Well, I mean, your standard answer, you're staying in shape, going to the gym and doing some sort of a fitness regimen. It doesn't have to be anything insane, but just at least 3 to 4 times a week
Mm-hmm.
and taking care of your body. If you have some sort of a team as far as body maintenance, whether it is, chiropractic or a stretch person or a massage, something just to take care of the body and help it recover as fast as possible so that you can live and have a good life.
That's good. That's very well wrapped up answer. I love that. I see that you have done so much studies and you have experience in so much myofascial work. I myself, I did a myofascial release
Hmm.
technique, the course, the basic and the advanced from India. I have my certifications from there, and I really enjoyed it.
Yeah.
And trust me, piriformis technique for release, I still use, I still use it till date. I used it in the morning
Yeah.
when I was seeing my patient. So for sciatica, amazing results.
Yep.
The myofascial release, which is very different from massage. Let me just
Yeah.
say that out. So can you tell me what myofascial release techniques are?
Yeah, I learned my technique from the John Barnes method,
Right.
and it's all about hydrating the fascia, trying to lengthen it, and trying to unwind it so that it can move better, so that the body can function more properly. So I, like yourself, used it today many times today. The sacrotuberous ligament, an area right where the hamstring connects
Right.
into the glute. It's a spot that I feel is not explored and not given enough attention. So in my system, my stretching system, the flow system, that's one of our first assessment checks, when we have our client prone, is to check that spot because it's oftentimes very inflamed, just from sitting for too long or postural imbalances or what have you. So it's things like that it's so effective for rehydrating the fascia, re-lengthening the tissue, and just getting it to be more functional and more balanced.
You mentioned hydration of the fascia. What do you mean by that, and how do you do it?
So the fluid that the tissue exists in, that interstitial fluid,
Right.
it gets bunched up, so it doesn't get the nutrients, and it doesn't get the hydration, and it gets too bunched up, so it doesn't get to move properly. So when we can lengthen the tissue and it can breathe more properly and it can get that fresh oxygenated blood in there, it's able to move more properly. So it's a lot more open.
Got it. Is it similar to lymph, or it's completely different concept from lymph?
It's similar.
Okay. So you would say that the tissue hydration is like it works in the way lymphatic system works?
Uh, I would say it's similar. I don't know too much about the lymph system.
Okay.
I more specialize in the fascia system, so I don't want to speak too
Right.
much. Sorry.
No, because I get the basis behind it. I did lymph. I'm a lymphatic therapist, so
Yeah.
movement helps. You know, circulate the lymph, and since lymph is like just waste from the body, it needs to be circulated. Otherwise, it'll just be clogged up in one of the lymph nodes, and that can cause more harm. So stretching is the best way to move the fluid.
Yeah.
So
It's more of like a byproduct. It's not necessarily like removing the lymph specifically, but it's more like a side effect.
right.
It's
What
a nice side effect.
it's yeah, definitely.
Yeah.
What do you mean by neuromyofascial stretching? How does that technique and that therapy work?
So when we refer to the neuromyofascia, that's the fascial system in general because it is connected to the nervous system, so that there's always that neuro connection. But I also refer to it in the sense that this therapy is very relaxing and it's very gentle. It's very parasympathetic. So when we're talking nervous system and as far as therapy, as we know, parasympathetic is much more subdued, much more relaxed and toned down. Sympathetic is much more amped up and aware and a little bit more frantic. So think like a high velocity chiropractic adjustment. It's a little bit more sympathetic. Not that it's a bad thing, but some people might not necessarily want, that big crack. It might not necessarily be relaxing for them. So it's neuro in two forms. So it's that the therapy is very relaxing, it's very calm, it's very soothing for the nervous system so the body can get the best healing that it can get, because it's, you're very relaxed, you're allowing it to happen. And it's also part of that neuro connection to the fascia and the tissue that we're working. So it does help that brain-body connection as well when we're trying to reintegrate the body back into normal function, whether it is reactivating hamstrings because the hip flexors are too dominant, so the hamstrings are underutilized. So we have to look at it from all aspects. It's not just getting the body back together; it's getting it back together, getting it stronger, and then getting it back into normal everyday function.
Yeah, I completely agree. Body should be seen as a whole. We sometimes, as therapists, ourselves forget and we'll just treat the part that we see injured. We don't see it as a whole.
Right.
And later on, when we carefully keep diagnosing it, like we keep assessing it, and then I realized that, hey, the back pain is coming from actually the neck because of the shoulders, the posture. So that's
Right.
causing the back to be in a certain way, and it's not the back that's actually weak, it's the posture that's coming from the spine up. So that's how even I'm, this profession is humbling me to see body as a whole,
Yeah.
and to look at it like sometimes you're tense not because of your physical aspect either. Sometimes you're just tense because of your mental stress, or you're emotionally just overwhelmed. So you'll see the
Right.
tension, and you'll have back pains. So I am observing that more closely as I'm working more and more. Uh,
Yeah.
how do you approach a patient? Like, I know you are also working with correction postures, different techniques to work on how, just correction of the posture. So how do you see and approach a person?
So obviously, everyone comes in for the first time. They do their intake form.
Right.
We go through some basic assessments, some overhead squat assessments. We can do some assessments on the table, but we generally do like a couple of static assessments, and then we'll get them on the table, see how their body reacts when we move them around there. Every session is personalized to every client. It's not just a simple system where we start with the foot, then we go to the knee, then we go to the hip. It's if you have back pain, we have an idea of what back pain is caused by, but just like you said, everything is connected. If I had $1 for every time I told a client that everything is connected, I would probably have a few $1,000s. I say it so many times.
Right.
So especially as regarding fascia, it's literally connected throughout the whole body. So just regarding like if a client has a headache, the fascia from the back net goes from the bottom of your foot all the way up and connects to your eyebrows. So
Uh,
if you see it attached to the skeleton, it's fascinating. So like you can work on somebody's foot and relieve tension in their head. So just like you said, you have to look at everything like it's from a fully connected unit. It's not just always my knee hurts, it's my knee. Like your knee could be hurting because your quads are
right.
overly active, or your calf could be overly active. So like it could be coming from above or below. You have to assess everything to give you the best possible result.
I know this is a very silly question, but I still want to know your opinion. Stretching or strengthening, what would you choose?
Stretching or what?
Strength training, what would you choose?
Both. Why not both?
But what would you approach? I mean, how would you approach? I like the answer.
what would I what would I do first?
Yes.
Well, I mean, you always want to make, especially if you're strength training, you want to make sure you're as limber as possible. So definitely stretch first,
First.
for sure. There's dynamic stretching that you can do
Right.
before a heavy workout where you're simulating movements that you're going to be doing during the workout to get your tissue more acclimated to, movement patterns, which is more what you should be doing. And then when you're done, you can do a more slow, more methodical form of stretching where you really, lengthen out the tissues that you already worked on. So you can get a little bit deeper, but go slower. So there's different kinds of stretching you should put yourself through. So everybody should have at least some sort of a routine. And stretching should never hurt, by the way, even when you're doing it yourself. If stretching is hurting, then you're going way too far. Stop.
What about ham stretch? Hams and TFL, they always tend to hurt, like even with my patients. And I look at it in a way that if it's not hurting, it's not stretching. You know what I mean? Not exactly hurting, but not exactly stretched.
You should always feel what you're doing, but it should never hurt. Because if it hurts, if it physically hurts, then you're either doing it wrong or you're doing it too
Got
much. Um, in regards to my system, when you're on the table getting stretched, it should feel great the whole time. A lot of my clients and patients have pre-existing injuries or we're working through something specifically. So they're going to feel it more, but they're never screaming or
right,
like trying to get off the table. It's an enjoyable
right,
experience. When you're stretching yourself, because we are, ourselves and we're prone to go a little bit harder for some reason on ourselves, we always go a little bit too far to where it burns. So there's always that preconceived notion that stretching hurts or is uncomfortable. It should never really be uncomfortable. You should feel what you're doing
right.
and then approach the stretch to where you feel it, back off, give the tissue some slack, go back into the stretch, and then if the range doesn't increase, then you found your end range. That's great. Don't go further than that because you're going to hurt yourself. If you go a little bit further, then you need to apply a little bit of traction. So it just depends on the angle of the stretch, come up and into it. There's a lot of different ways you can go about it safely. You can do neuromuscular stretching, which is proprioceptive neuromuscular facilitation, PNF. That's also something that you can do, contract the muscle and then relax. It allows you to get a little bit further, a little safer. There's a lot of different things that we can do. We just need to approach it better. The way that we were all taught how to stretch when we were kids is not good.
That's what I always keep, I always had that pre-notion in my mind that if it's not burning, you're not stretching. So
yeah, on that president's test, I was always like ripping my hamstrings apart just to get an extra inch because it made me feel taller.
Really? Did that actually happen?
No, I didn't get taller. I just hurt my legs.
No, but since you mentioned PNF, let me tell you, for PNF, I love the whole relax and contract relax technique. Amazing results post-surgery, especially ankle, knee. It's amazing results. Just the whole relax, contract relax techniques. How much do you use and apply PNF, and what cases do you recommend for PNF techniques?
So when I was teaching stretch therapy years ago, and if I'm training any associates, when I teach PNF, I teach it to use it like it's a spice. You use it as needed. You don't have to do it every single time, especially because this is a parasympathetic, relaxing therapy. I don't want to inundate somebody's relaxation time with push, 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 push. So I use it as it's needed. If the tissue is moving nicely, it's not really needed. I will find the end range myself gradually. I don't need, I'm not hitting a brick wall, but typically hamstrings, glute muscles are great candidates for PNF because it's just a little bit harder to get a good hamstring stretch. It's much more of a sympathetic stretch as much as you want to relax. Like a hamstring stretch doesn't feel good until it's over.
Yes.
Glute stretches are a little bit more enjoyable, but they do push that button for clients, so to speak. So PNF is a little bit better just to speed up the process, so to speak, and again, in a safer way, so we're not stressing their system out so much and the tissue can go and progress naturally.
Right. The glute stretch, there are clients who will either love it or hate it.
Yeah, there's no in between.
There's no in between.
No. If it's really bad, we can always do it from sideline, and it becomes a whole different technique, but it's much more relaxing and enjoyable.
Yeah, there's no in between. They're either like, oh, keep going, we love this stretch, or they're like, okay, we're not doing that ever again.
Yeah.
What do you mean by Gua Sha?
So Gua Sha is a Chinese technique. It's an instrument-assisted soft tissue manipulation, akin to Graston or Factor. I believe they're obsidian-based stones, and they are just concave. I'll grab one real quick. Come on. Yeah. So they're little stones like this, and this is the main one that I use mostly because lats and rhomboids and spinal erectors in the back, all those muscles, that's a fantastic tool for breaking up fascial adhesions there. But it's a great way to break up, like I said, fascial adhesions, knots, scar tissue. It's a great precursor for my myofascial release. If I have an adhesion that I just can't break up with my fingers, or I want to save my hands, for years down the road, I like to use the Gua Sha. And because I also use my hands with my myofascial release, I don't have to dig into their soul, so to speak, and I don't
Yeah.
have to make it horribly unenjoyable. So I can still, I don't ever want to betray that parasympathetic, relaxing therapy. While it is more aggressive, it is still enjoyable. I don't have clients that are, again, still trying to hop off the table or are praying for it to be over. It's just a one aspect of tissue manipulation that I like to use before I hit the myofascial release, before we can, like I said, lengthen it and rehydrate that fascia so it can stick and be a little bit, more mobile.
Uh, how do you differentiate between, this is a very common question, how would you differentiate between patients that love aggressive release? Because I have patients who love the aggressive release, especially with trapezius. And myself, I like to go a little deep. But then there's a fine line between going too deep and causing bruising, or just being the
Mm-hmm.
perfect, pressure. How would you differentiate that?
So I definitely have those clients as well, more along the lines of just keep going, it's
Yeah.
fine, just keep stretching. And to them, I say that's okay, that's fine. But if your tissue stops, I'm gonna stop.
Right.
Like I'm not going to yank your leg out because you think it's okay. Like I do know where the tissue stops. Like that's part of my system as well, is awareness of the client's body so that there's never any pain associated with the stretching. So in that regard, that's what we do. But as far as when I'm doing tissue manipulation, if I have a client that wants a lot of pressure, I'm a firm believer of melting into the tissue and not bullying your way into the tissue. So what I mean by
Right.
that is we go in, we go in slow, and I'll get there. Just give me a minute. Just give me a minute. I'm not going to just push straight down until I say it's over. So we like to work with the body, not necessarily against the body. So I'll get there with the pressure, and a lot of times I'll have clients that are more sensitive per se, and I'm digging into their knot by the end of like a minute or so of being there, but they're like, this doesn't actually seem like you're doing a lot of pressure. I'm like, I'm pressing pretty hard at this point. Like I wasn't, trying to aggressively get in there. So it's much more of an enjoyable and a much more streamlined process. So we get there just, with more patience and care.
Talking to you clears so many concepts about stretching and about myofascial release, because where I know a few practices that believe that if the patients are not bruising, that means you're not stretching or you're not doing enough manipulation. And I kept saying, no, you're not supposed to
Mm,
bruise. Like, that's you
yeah.
as therapists are causing more harm. And they're like, no, patients are used to it. And the patient used to come back. I have seen patients where they came back with blue, green, yellow marks around the muscle. And it was so sad, but they kept telling us, no, you gotta go deep, you gotta still keep doing, you have to still go deep and be aggressive with the tissue. What are your thoughts about that? I know
I
it's sad.
it well, here's the thing, like there's, as long, because you can damage the fascia. You can damage
Right.
tissue. You can rip and tear. When there is bruising, typically that's, blood capillaries that are bursting underneath the surface. When you're like with Graston technique, like it's gonna happen. It doesn't have to be so. It doesn't have to look like the muscle has torn off the bone, like that kind of bruising, because sometimes it does, and it's a little insane. Um, with tissue manipulation, with myofascial release, like sure, like you'll have a little bit of red marking, but not bruising. It's not bruising. It's superficial. Um, there's plenty of ways. Pardon me. There's plenty of ways to touch the tissue and to get in deep without having to break
Right.
blood capillaries and to break those tissues. I think that's a little bit old hat,
Yeah.
a little bit outdated ways of thinking. I don't prescribe to that
Hmm.
or subscribe, whatever it is. Um, I would prefer to do something relaxing and then have the client leave and feel better instead of having to endure something and then feel better afterwards. I think it's a lot more better. It's a lot more better that way.
Definitely. No, I kept telling the patients, this is not good. They're like, no, but we feel good after. Just ignore the bruising. We feel good after this. So
And
I did not.
then how soon after do they not feel good?
I know. I kept telling them it's only gonna cause more wear and tear in the microfibers that you have, like in the deep tissues. That's the sign that your deep tissues are getting damaged. So we should not support it, and we should not. And I never gave that. Like, I never supported it, which is why I always supported stretching, my PNF techniques, which gave me amazing results.
Hmm.
Especially like you said, with you know what it feels like, you as a therapist, and you've reached the end range, and then you can push a little beyond that. So cases like frozen shoulder,
Hmm.
beautiful results. And I never expected to see that firsthand, but after I started practicing and came across more cases, and you can see like they were struggling for so many months to get their ranges back,
Yeah.
50, 60 degrees. But then after we did a few sessions, 5, 6, and they were doing amazing. Again,
Yeah.
I was not doing it every session, but I loved the progress that we saw, so I would recommend that uh to all my patients.
Yeah. I've had three or four, four people that have had frozen shoulder, with one that I'm seeing literally today. She injured her shoulder and it was trending towards being
Right.
frozen. And I because I'd seen it before, I said, get in today. Like we need to start moving you like right now before it gets really bad. And I actually was out for a few weeks because my wife and I just had our third child. And
Congratulations.
thank you. Um, and when I got back today, she said my shoulder is really bad. She's like, I can only get it to here.
Oh,
Um, so after, yeah, but she was, get up, she was lifting her, so her traps were basically synergistically taking over for her shoulder. So I had her face down, and we basically worked her whole lat and rhomboid and rotator cuff
right.
process. And then when she flipped it over, she was actually able to get her arm a little bit further than she already had. And then we just did the normal session. And then she went from here to here just after today. So I'm like, it'll be like, she's like, do I need surgery? I'm like, hey, it'll be all right. Like, just give it a little time, but you'll be okay. Like, just we
Yeah.
caught it to the point where like she's actually not in pain either. Like the range of motion needs to get better, but she's not actually in pain. So that's the best part.
Yeah.
Because usually there's a lot of pain.
Understanding frozen shoulder is, it's so complicated, but it's also easy. Once you catch it and you're working with it, then it's just smooth. But yeah,
Yeah.
pain that comes with it, it's definitely a part of it. So I just keep telling everyone, just hold on to it, it'll go. It's also a phase of frozen shoulder, but we work through it, definitely.
Yeah.
Does Gua Sha cause bruising? Does Gua Sha cause any side effects?
So Gua Sha, it could. I mean, in the hands of somebody that just is going crazy with them. But Gua Sha is a more mild version of instrument assisted soft tissue manipulation. I use it even more mildly than it's probably prescribed because I also do myofascial release with my hands.
Right.
So, like I said, like I mostly use it for acupressure. So instead of the intense scraping, I usually stick to a spot and I do some circumductive circling. so I can break up that area's adhesion, and then I can lengthen and separate and get the tissue hydrated. So uh, it's all depends on the practitioner. So my technique is less broad strokes and more pinpointed um, to the specific area I'm working, and then I go in with my hands.
Would you first stretch the whole band of muscle, or like you mentioned, you would work part by part where you found knots and tightness, or how would you approach it?
So when it comes to my assessment process, I have my specific areas that I like to check, uh, like the sacrotuberous ligament, the lats, the rhomboids. A lot of my clients who are at a desk all day sitting. So basically, just like a lot of my clients I've known for years at this point, so I just kind of know what they do, how they are. But like if somebody new came in, I always, aside from taking their intake, we have a conversation. What is it you do? Uh, do you have anything pre-existing? Do you have any injuries right now? Just try to get a little bit of an idea of what their lifestyle, what their hobbies, and what their everyday life is like, and that will lead me to either why they're dealing with what they're dealing with, or just to give them an idea of opening their eyes to maybe something that they didn't necessarily notice about why they have what they have, or why they're experiencing what they're experiencing.
Right. Which makes
So
more
we all take that into account. So that's my long-winded way of saying is it depends on the person, but the first session is usually a global assessment of the body, and then when I get their stretching program and their protocol, then I will probably go a little bit more local depending on what I found. But again, every session is typically different. Once my clients come in and they're in what I call their maintenance mode, then their sessions will probably be a little bit more streamlined because we're just keeping you up for maintenance. So we're going to just keep doing what we were doing because you're already great. Unless you come in and you're like, hey, I tweaked my neck. Can you work on my neck today? Or whatever it is. But that's what we want. We want you to just come in and have something that day. We don't want something to not go away ever. Then why do you keep coming back?
right. Makes sense completely.
Yeah.
Oh, you mentioned about the stretching program. How do you make the flow of a stretching program? How many sessions? How many weeks? How do you go about that?
And again, I hate to say the same thing every time, but it depends on the person.
Personally.
Um, if they're dealing with chronic pain, and my definition of chronic pain is not your definition of chronic pain, but the way I would define it is you wake up in pain, you're in pain throughout the day, you go to bed in pain, maybe even worse. It's just not going away. I wouldn't necessarily say an annoying ache would be chronic, even if you feel it all day. That's just my feeling. But if that's how you feel is chronic, that's fine. But usually I would say once a week for somebody dealing with like a normal ache or pain, or a simple back injury or something, something not crazy. But if somebody has chronic neck pain, chronic whatever pain that they're dealing with, and it's just unbearable, then I would probably say twice a week. I've never had anybody needs to come more than twice a week, and that's not a gloat. It's just, it's very profound work. It's not necessarily needed. If you want to come more than twice, then, but great, no big deal. But I would recommend twice for chronic pain. And as far as how many weeks, again, depending on the severity of the injury, like at least a month, so that we can see some tried and true results, and we can actually see where we are at. Most of my clients are usually in maintenance mode within the first life cycle of their first go around. Um, and then if it's something more severe, they're at least seeing positive results and an uptrend of their health. So it's always a good thing there. And then if they want to scale back as they're feeling better, then great. But we still want to make sure that they're coming in just to keep up their maintenance and just to make sure that nothing comes back or anything new comes up.
Right. how did you get inspired by stretch, by myofascia? What pushed you towards getting into this profession?
So I was a personal trainer for a number of years, and it wasn't my passion, but I did like helping people. But I ultimately wanted to help people like with my hands on them, inspire in the therapy sense. I wanted to be a physical therapist
Right,
originally. It didn't work out life-wise as far as the schooling went and stuff. I was able to get my um, I need basically I got everything that I needed to go to physical therapy school, and then I just wasn't able to make that jump, unfortunately. Um, and then I heard about fascial stretch therapy one day when I was at a training for work one day. And this was after my other job shut down and we had to move to a different gym and I lost like 80% of my clientele and I was kind of just trying to, like my first child was on the way and I'm just like, maybe I'll just be a mailman or something, like I don't know. And then I just heard about fascial stretch therapy offhand somehow. I don't actually remember how. I looked it up and I realized, okay, this actually seems like something I would enjoy that is like physical therapy-esque,
right,
if you will.
right.
Um, and I went for it. It was a little bit of a gamble, but it paid off tremendously. I found my love, my work love, if you will. I got my specialization in that method. I taught for them for a little while. I helped some colleagues develop their method, which is called soft stretch release techniques. I then learned myofascial release. I then learned Gua Sha. I developed my own stretching system, the Flow
Right.
system, with it, which is basically a combination of learning of all of the techniques that I have learned and innovated on, and tissue manipulation techniques that I've come up with that um, have given me some of the best results of my career. It's been really nice. It's kind of like a story. You bet on yourself, and things kind of work out when you put the work in. It's nice.
Definitely. You were destined to not take physical therapy. We would miss out on a good myofascial therapist like you.
I know. Maybe one day.
No, but the certifications that you have, the knowledge that you have, I don't think this physical therapy school can ever give that to you. The experience, the hands-on that you have, you have so much more to offer than PT, to be very honest. Plus, you do strength training. You were a personal trainer, so you know both aspects of what it takes for a body to work, stretch and strengthen. So it's a complete package. So it's perfect.
Well, I appreciate that. Coming from you, that means a lot.
Definitely. I am so inspired because I saw your videos and with the confidence and with the techniques that's so new, like a lot of there are so many people who still believe that you just have to massage and you'll get better. So to educate people that hey, that's not the right way to do it. There's a difference between myofascial release, there's a difference between massage, there's a difference between different techniques that we're using. And then watching your videos, your own flow stretch flow program, like your own techniques, it's amazing to see how it's growing, and it's you're having so many clients and it's working. So
Yeah,
it's amazing.
yeah. I appreciate it. Thank you. Yeah, it's a trip. It's I've never had a job before that I held for more than like 2 years that I didn't eventually grow to like dislike.
Right.
Uh, and I've been in business for over 6 years at this point. It'll be 7 years in June. Um, and the days just fly by.
Yeah.
You know, I go in at 9, I leave at 9, 9:30 sometimes, and it's 6 o'clock. I'm like, how is it 6 o'clock already? I don't understand. Um, it's great. You know, I love what I do. My clients know that I love what I do. And you know, I have an associate that works with me. His name is Mike. He's fantastic. I love having the ability to teach and to educate because that's my second love is to teach. So I get to combine that and to see him grow as a young therapist. He's getting his own little book of business, so he's on his way, which is awesome to see. And you said you're inspired by my videos. I don't know if he's watching, but my social media guy Andrew, he's fantastic. He's the one who produces everything, so he's great.
That's awesome. I can see you have such an influence on the people around you, and you have a great team working with you. So it, you can see it. It's already going so well. It'll only get better.
Absolutely.
Would you recommend telehealth for your clients that are already doing years of therapy with you and just for maintenance part, like we were talking, would you recommend telehealth or no?
Telehealth?
Yes.
Oh, I mean, like I'm not on it. Is that what
No, just like
is that what you mean?
no, just like would you recommend patients to do their stretches and their program online, or would you like to have them in person and have the experience in
Oh,
person?
gotcha. I actually give my clients their own stretching protocols for when they're home. So I
Okay.
have them record me doing it so that they have it forever, so they can't tell me that they forgot it. I like to give everybody my their protocols in person. So I like it better that way. If they have no access to it, then yeah, of course, like go online and get the information that you need if for some reason I'm inaccessible. But I'd much prefer to uh, prescribe it to them myself.
Definitely. Yeah. Hands-on always, but we're living
Yeah,
in a world post-COVID, especially, it's taught us so much to go online and just start doing things that I never imagined we'd be doing online, like doing
I
physical
know,
therapy. So, yes. Do
definitely.
you have any mentor or any person that you look up to in this profession?
Yeah, two guys, Dr. Jason Pape and Dr. Jared Leon. Dr. Jason Pape and Jared Leon, they're both chiropractors. I work out of the Vitality Center, which is Dr. Jason Pape's office, and I also work out of uh, Jared Leon's office in Stony Brook. But the time that I've spent with them and picking their brains and learning from them, as far not only just about the body and how to help my clients better, but how to help my business better. Because, you know, truth be told, when I started doing this, I had literally zero idea what I was doing other than how to do the work that I did, but I didn't know anything about running a business. I didn't know anything about, um, you know, making a model or a mission statement or anything. I didn't know what I was doing. I just knew I wanted to do this on
Right.
my own. Um, so they helped a lot in that regard as well. So couldn't ask for a better group of business mentors. And also, I have a business mentor, Steve. I would be remiss if I did not mention him as well.
That's awesome. Thank you so much for your time today. I loved having this conversation, and it was so lovely to know that there are so many techniques out there, and it's such a growing field that we're always updating ourselves, updating our techniques, our hands on, and we should be doing that. And you are one of those persons, life model, who is, demonstrating that and sharing it on social media, which is huge. So thank you so much for giving me your time and talking to me today.
Thank you, Bob. Nice. I appreciate it very much. Thank you so much.
Have a Lovely night. Say hi to your kids for me.
I will. Thank you. You too. You have a good one.
Bye bye. Take care.
Bye.
Thank you for listening to our talk about health. You can follow me on Instagram at bhavna.devnani, on Facebook at bhavna devnani, and we'll leave all the information in the description below. Thank you.